In this video, we will discuss what are the potential factors that damage human mental health. Damage to mental health can result from a multitude of factors, each contributing to an individual's overall well-being. Here are several potential reasons behind mental health challenges. Biological factors: genetics and brain chemistry can play a significant role in mental health. Genetic predispositions to conditions like depression, bipolar disorder, and schizophrenia can increase vulnerability to mental health issues. Additionally, imbalances in neurotransmitters, such as serotonin and dopamine, can contribute to mood disorders. Traumatic experiences: trauma, whether physical, emotional, or psychological, can have profound and long-lasting effects on mental health. Events such as childhood abuse, neglect, violence, accidents, or natural disasters can lead to conditions like post-traumatic stress disorder (PTSD), anxiety disorders, and depression. Chronic stress: prolonged exposure to stressors such as work pressure, financial difficulties, relationship problems, or caregiving responsibilities can take a toll on mental health. Chronic stress can lead to burnout, anxiety disorders, and depression if left unaddressed. Social and environmental factors: social determinants of health, including socioeconomic status, access to education, housing, and healthcare, can impact mental well-being. Discrimination, social isolation, bullying, and lack of social support can also contribute to mental health challenges. Substance abuse and addiction can exacerbate or even cause mental health disorders. Drugs and alcohol can disrupt brain chemistry, leading to conditions like substance-induced mood disorders, psychosis, and addiction. Chronic medical conditions: chronic illnesses such as cancer, diabetes, autoimmune disorders, and neurological conditions can have a significant impact on mental health. The stress of managing a chronic condition, along with physical symptoms and limitations, can contribute to depression, anxiety, and adjustment disorders. Grief and loss: the death of a loved one, divorce, separation, or significant life changes can trigger intense emotional reactions and grief. Unresolved grief can lead to prolonged mental health challenges, including depression and complicated grief. Personality factors: certain personality traits such as perfectionism, pessimism, or low self-esteem can increase vulnerability to mental health issues. Individuals with a history of mental health problems or personality disorders may be at higher risk. Unhealthy lifestyle choices: poor nutrition, lack of exercise, inadequate sleep, and unhealthy coping mechanisms such as avoidance or substance use can negatively impact mental health over time. A lack of access to mental health services, limited access to affordable mental health care, stigma surrounding mental illness, and cultural barriers can prevent individuals from seeking help when needed, exacerbating mental health challenges. It's essential to recognize that mental health is influenced by a complex interplay of biological, psychological, social, and environmental factors. Addressing mental health issues often requires a comprehensive approach that considers these multifaceted influences and provides support tailored to the individual's needs.